Cancer, the silent disease with 100 faces. Know the early symptoms before it's too late. Cancer isn't just one illness. It's a complex group of over 100 distinct diseases, all of which are caused by the uncontrolled growth and division of abnormal cells in the body. These cells can invade nearby tissues and spread to other parts of the body if left untreated. While cancer can develop in virtually any organ or tissue, it most commonly affects the lungs, liver, pancreas, colon, prostate, uterus, ovaries, skin, and blood. The key to successful treatment often lies in early detection, which is why recognizing the warning signs, even the subtle ones, can potentially save your life. Just like any medical condition, cancer gives off early signals that should never be ignored. In this video, we'll walk you through some of the most important symptoms of cancer, and we'll also discuss what causes cancer in the first place, so you can take preventative steps to protect your health. Stay with us till the end, as number 1 will surprise you. But first, if you're interested in life-saving health content like this, please hit the like button so we know to create more videos on this topic. And if you're new here, subscribe and turn on the notification bell so you never miss our science-backed health tips. Also, I'd love to connect. Drop a comment below and let me know where you're watching from. I always enjoy seeing where everyone's watching from. It creates a sense of connection, no matter how far apart we may be. 15 warning signs of cancer you should never ignore. 15. Unexplained or abnormal bleeding. Any form of unusual bleeding is a red flag. This includes blood in the urine, which may indicate bladder or kidney cancer. Rectal bleeding or blood in the stool, which could suggest colorectal cancer. Bleeding after coughing, which may point to lung cancer. Even if the bleeding seems minor or infrequent, it's essential to get tested to rule out serious causes. 14. Severe abdominal or pelvic pain. Chronic or sharp abdominal pain, especially in the lower pelvis, may signal ovarian cancer. For women, pain in the ovarian region that doesn't go away should be investigated right away. Additionally, pain in the upper abdomen, particularly when accompanied by loss of appetite, persistent fatigue, or nausea, can point to pancreatic cancer, one of the more silent and aggressive forms. 13. Changes in nail appearance. Subtle changes in your nails can be a window into your internal health. For example, black or brown discoloration under the nails may indicate skin cancer, such as melanoma. Clubbing or thickening of the fingertips and nails could be a sign of lung cancer. Pale or white nail beds may also signal liver issues, which can sometimes be related to cancer. Don't overlook changes in nail color, shape, or texture, especially when they appear suddenly or without clear explanation. 12. Extreme fatigue and general weakness. Feeling constantly drained, to the point that simple daily activities become difficult, such as standing for more than 2 to 3 hours or walking short distances, could point to leukemia or other blood-related cancers. Unlike typical tiredness, cancer-related fatigue doesn't improve with rest and may be accompanied by sudden, unexplained weight loss, pale skin, or frequent infections. 11. Difficulty swallowing and chronic hoarseness. Trouble swallowing, known as dysphagia, that continues over time can be a symptom of esophageal, throat, or even lung cancer. When this is combined with persistent chest tightness or a hoarse voice that doesn't improve, especially in the absence of a cold or infection, it could indicate the presence of a tumor pressing on the esophagus or vocal cords. 10. Unresolved intestinal issues. If you're experiencing constipation, diarrhea, or irregular bowel movements for more than 3 weeks, and you haven't changed your diet or lifestyle, this could signal colorectal cancer. Long-term bowel changes, especially when paired with blood in the stool or abdominal pain, should never be ignored. 9. Persistent bloating and indigestion. Regular bloating and digestive discomfort, especially after eating, may point to more than just a sensitive stomach. In some cases, chronic bloating and indigestion can be early indicators of ovarian or stomach cancer. If the bloating becomes worse after meals and is accompanied by early satiety, feeling full quickly, nausea, or unexplained weight loss, it's critical to seek medical attention. 8. Shortness of breath and persistent cough. Difficulty breathing or severe shortness of breath, even when you're not exerting yourself, may be caused by a tumor pressing against the lungs. Similarly, a chronic cough that doesn't go away can be a sign of lung, throat or thyroid cancer. If your cough lasts longer than 3 weeks or brings up blood, it's time to see a specialist. 7. Chronic pain with no clear explanation. Persistent, unexplained pain, whether it's in the bones, joints, back, or pelvis, should not be dismissed, especially if it lasts more than a few weeks. Cancers such as bone cancer or testicular cancer can cause localized pain that doesn't respond to normal treatments. 6. Recurring infections and persistent fevers. If you're frequently getting sick, experiencing constant fevers, chills, or flu-like symptoms, it might be more than a seasonal virus. Leukemia and lymphoma, blood cancers, can weaken your immune system and increase your risk of infections. Ongoing fever that has no clear cause should be investigated. 5. Unexplained weight loss. Losing weight rapidly without changing your diet or exercise routine can be a major warning sign. Cancers of the pancreas, stomach, lungs, esophagus, and liver often trigger weight loss by increasing inflammation or affecting how your body absorbs nutrients. Sudden weight loss of more than 10% of your body weight should prompt immediate medical testing. 4. Chronic acid reflux or persistent indigestion. Frequent heartburn or a burning sensation in your chest after meals may indicate more than just gastrointestinal discomfort. Chronic acid reflux, also known as GERD, has been linked to esophageal or stomach cancer. If this is a regular problem, especially if paired with difficulty swallowing, seek medical advice. 3. New or changing moles and skin spots. While many people have moles or freckles from birth, newly appearing spots, or existing ones that change shape, color, or size, can be a red flag for skin cancer, particularly melanoma. Consult a dermatologist if you notice any skin irregularities. 2. Unusual lumps, masses, or swelling. Finding lumps or unexplained swelling in any part of the body, whether in the breast, neck, underarms, abdomen, or groin, should never be overlooked. Persistent or growing masses could be signs of late-stage cancer. An immediate medical evaluation is essential to determine the cause. 1. Yellowing of the skin or eyes, jaundice. If the whites of your eyes or your skin develop a yellow tint, this could be an early warning sign of liver or pancreatic cancer. This yellowing, known as jaundice, occurs when there's a buildup of bilirubin, a substance the liver normally helps eliminate. Cancer can develop due to a wide range of environmental, genetic, and lifestyle-related factors, including smoking and tobacco use, the leading cause of preventable cancers worldwide. Alcohol consumption, especially in large amounts or over long periods. Poor diet and obesity, linked to multiple cancers including colon, breast, and liver. Chronic stress, depression, and poor sleep patterns, which may weaken immunity. Excessive sugar intake and nutrient-poor diets. Family history and genetic predispositions. Exposure to industrial chemicals, pesticides, and hormone-disrupting substances. Long-term sun exposure without skin protection. Physical inactivity and prolonged sedentary behavior. Understanding these risk factors helps you take proactive steps to prevent cancer or reduce your risk. Cancer can often go undetected until it's in an advanced stage. But early signs do exist, and your body is constantly trying to alert you. Don't ignore persistent symptoms. If something doesn't feel right, it's better to investigate sooner rather than later. If you've experienced any of these warning signs for more than 2 weeks, consult your doctor or a specialist immediately. If you found this video informative, give it a thumbs up and share it with your family and friends. You could help someone catch a life-threatening illness early. Comment below if you've ever ignored a symptom that turned out to be serious. Subscribe to our channel and turn on notifications so you never miss important health updates. Remember, prevention starts with awareness, and knowledge can save lives. Stay informed. Stay healthy. Thank you for watching, and we'll see you in the next video.